Well, hello. Welcome to Jumpstart to Clinical. This is part one. My name is Luann Lonergan, and I will be your nursing instructor at Clinical at Rocky Knoll.
And I'm Carrie Ham, and I will be your clinical instructor at St. Mary's at Felician Village.
My name is Lori Hurdle, and I'll be your clinical instructor at Manitowoc Healthcare Center.
Well, wonderful. We have gathered today just to go over a couple of things. The goal of this little Jumpstart to Clinical is to review and practice some safe body mechanics and basic nursing skills. Look at some resident safety in the safety simulation room so that you will be safe in clinical for your resident and yourself, and also so that you'll pass clinical. So to be a good nurse, you have to be good at some basic nursing skills. I have a CNA skills cheat sheet, so 9 top areas that we're going to look at to make sure that you're safe with residents. So the first one, hand washing. Make sure that's at least 20 seconds when you wash your hands. When you have gait belts, put it through the teeth first and use an underhand grasp. When you're transferring someone, make sure that you lock the wheels on the wheelchair. Transferring, make sure you put on non-skid footwear. When you transfer someone to the bed, to the chair, or a wheelchair, you always want to transfer to their stronger side. When you position a client on the side, make sure to lower the head of the bed and move them towards yourself before you roll them, so you don't roll them into a side rail. Mouth care. Clean the entire mouth, including the tongue and all teeth. And when you're doing peri-care, make sure to use a front to back with the clean area of the washcloth with each stroke. And the last CNA skills cheat sheet area would be when you're dressing a client, make sure to dress the weak side first. All right, so back safety, just a couple of statistics. Nursing is ranked as the 6th most at-risk occupation for back injuries. 52% of nurses complain of chronic back pain, and 12% leave the profession because of back pain. And we want to prevent those for you guys. So we're going to give you a couple things. First thing we're going to do is some warm-up exercises. So Lori and Carrie are going to help me. And these are just a couple of warm-up exercises that we're going to do. So we're going to reach up ahead, and you might be able to do a couple of these at home. Good job, you guys are doing them. We're going to just kind of swing our arms a little bit front and back. We're going to just get some blood moving in our muscles before we do some work. We're going to march a little bit. All right, good. A real nice gentle stretch for our back. We're going to take our hand, our right hand on our left hip, and we're going to extend back. This is a great stretch for the neck and the back. Beautiful. You guys are doing a good job. Now we're going to go to the other side and stretch. Beautiful. All right, we're going to do a side stretch. So we're going to bend our knee and kind of go off to the side. Very good. Are you guys feeling the stretch?
Yes.
Oh, yeah.
And we're going to go off to the other side. All right. Another one that's good is if you kind of put your feet hip width apart, we're going to bend our left knee and put our hands on our hips and just bend over our knee, our bent knee, and you should feel it in your back, a nice stretch in your lower back. Do you guys feel that?
Yes.
Mm-hmm. And then we're going to go the other side and do the same thing. And we're going to bend it. If our nose goes over our knee, I can really feel that in my lower back. And one more stretch that you might have, we're going to do, we're going to touch our toes, but we're going to do this bending our back knee and keeping our front knee straight. And we're going to reach over, and that's a nice hamstring stretch. That feels real good actually in the hamstring, and we'll do one more. All right, we can shake that out. So if you ever want to do some of those before you start clinical, I think that would be a good thing. All right. Some of the things that, there's a couple of principles that I just want to share with you, which would be real good to share with students. A couple of things that I've learned from some PT friends and just from being a nurse for a while. Probably the biggest advice that I would say is when you are moving someone, you want to have a staggered base. This stance right here is really going to be, you've got a wide base of support. Now we're going to shift our weight. So we're going to really move people doing it like this. We're going to use your strong flexor muscles. I see that you're doing it. That's excellent. We're going to try and keep the weight close to ourselves if we can. And also what we're going to add when we do this, we're going to count. We're going to rock and roll people. So on the count of 3, 1, 2, 3. When we move someone like that, when we count, it's called rhythmic initiation. And that kind of gets the patient ready. They start thinking, does she mean it? Does she mean it? I think she does. So that really gets their muscles and their mind kind of thinking that they're going to move. Another thing that, another area that people have trouble with is that when they turn, they twist their back, and when they lift a resident or something, they've got too much torque on their back. And so it's all in the feet. So what we can do, instead of twisting, we can just pivot. So when you see, you can turn your feet like so, you don't have a twist in your back. Another way that we can do that is you can go on the balls of your feet and you can twist almost like you're skiing. Lori, are you skiing?
I'm skiing.
All right, that's another way. And if you can't, perhaps with the shoes that you have, you can actually just turn. So you can actually just pivot like so. You can just move your feet and then you're not twisting your back. So those are 3 different ways. Sometimes you'll be in a situation that it seems like you're going to twist your back, and these ways to place your feet are going to be helpful. One last thing before we go to the skills. When we are doing a transfer, a 2-person transfer, someone should always be in the front. So one of the caregivers, the nurses, should be in the front, and the second person should either be behind or on the side. That's the safest. We don't want to transfer people side to side because that resident is too unstable. So we'll show that when we go through the skills. So I'd say we are ready to go to the skills. The first skill we're going to do, Carrie is going to be our lovely patient. Good job. And we're going to move the client up in bed. So this would be a client or a patient that we would have. So Lori is going to put the head flat. We always want, because we don't want to go up against gravity. And she's also going to raise the height of the bed about hip weight, about hip level. Make sure that the bed is locked. So we'll make sure that looks good. We don't want to have the pillow be a dragging, so we're going to move that pillow to the top there. Excellent, good. And some of the things that we'd like to do is elicit help from the client or from the patient. So what are some things that we could have Carrie do?
Carrie, I'm going to have you bend your knees right here. And I'm going to have you put your arms either across your abdomen or across your chest.
Beautiful, excellent.
And then we're going to tell Carrie when she can help push herself up on the count of 3.
And she can also lift her head up at that
She
time.
can lift her head up.
Wonderful. We've got a lifter sheet here, and we're going to use, again, our stronger muscles, our flexor muscles. So we're going to hold it like so. My feet, the foot that's positioned closest to the head of the bed is facing there. And sometimes I even like to put my knee up. Lori likes to do it that way, but on the count of 3, and I'm going to let Lori be the counter then.
On the count of 3, Carrie, you can lift your head and push. Ready? 1, 2, 3.
Beautiful. All right, we'll get that pillow fixed there. Excellent job. All right, did that feel okay?
Yeah.
All right,
I'm
good.
comfortable.
You're comfortable. Good. All right, now we're going to turn the client on the lateral, position her on the lateral side. So one of the first things that we need to do is we're going to move Carrie to the side. So we have to move her to the side first, or else she may get turned right into the side rail. So on the count of 3, Lori, you call it.
Ready? 1, 2, 3.
Beautiful. All right, that's good. All right, so we're going to do a couple of things. We're going to the far arm. We're going to externally rotate and abduct there. We're going to keep this arm kind of across here, and actually she'll be able to grab
Side rail.
the side rail. Good.
We're going to have her bend her knee, and we're going to tell her on the count of 3 she can reach across with her right arm and actually grab the side rail.
Okay,
Ready?
good.
1, 2, 3. And Luann will just help
Beautiful.
position her over. Because Luann is there, I can leave and grab my pillows.
Okay.
And I'm going to put the first pillow under her back, straight, and then have her kind of lean back into it.
All right, good.
And then we're going to put a pillow under her knee here. And then we're going to put one in the front of her so that she can rest her arm on.
Oh my, she looks pretty
And
comfortable.
Carrie, are you
Yeah.
comfortable?
I'm ready for my nap.
All right,
Okay.
good. So that would be a safe way to laterally roll up a patient on the side. All right. The next thing, Carrie, I'm sorry, we're going to have to let you go here with this comfortable position. We're going to get you dangling. So we're going to take away all of these pillows. All right, good. And one of the things, I'm going to have Lori do this, and I'll kind of explain some of the things. We're going to get Carrie sitting, dangling on the side of the bed. So one of the first things she's going to do, we call that maybe chunking that person over. There's quite a bit of room here, and Lori's going to have to be extending here quite a bit. So she's going to move Carrie a little bit closer to the edge of the bed first.
Okay, and because I'm tall, that's as high as the bed goes, and again, we don't want Carrie to be unsafe, so we're going to put my hand underneath her shoulders here, not around her neck, and we're going to say on the count of 3. Ready? 1, 2, 3. I'm going to just move her shoulders over.
Good job.
Then I'm going to chunk, as Luann says, her middle section on the count of 3. Ready? 1, 2, 3, and we're going to move that over. And then down here, I'm going to come, and I'm always going to bend my knees and go, ready? 1, 2, 3. So because I'm tall, I don't want to bend like this. I always want to bend at my knees. Okay.
Then she's going to lift up the head of the bed. That's going to help her. And then she's going to lower the bed so that Carrie's feet will be able to touch the bottom. And she also, once she's done with that, she has to make sure that Carrie has some non-skid footwear on. Beautiful. So we want to make sure that that resident's going to be able to touch the floor.
Okay, and I might even move her feet a little bit closer this way because, again, I'm tall, so I might even have her just move her feet over a little bit. Okay.
Great. Lori's going to go underneath her shoulders.
Have you lean forward for me?
And underneath her thighs. And she's
Okay.
got a real good, strong, good stance there. And she's going to, on the
Yep.
count of 3.
And Carrie's going to push off with her left hand on the count of 3. Ready? 1, 2, 3.
Beautiful. That's
Good.
very good.
Noting that I didn't bend over, I just kind of pivoted.
All right.
Now, if Carrie is not close enough to the edge, we may say, Carrie, can you boost yourself closer to the edge of the bed?
Okay, and we could even take the sheet and
sheet.
boost her over
Good.
if we need to.
Do you want to bring the wheelchair over?
All right, the last thing we're going to do is we're going to transfer Carrie to a wheelchair. I'm going to make sure that that wheelchair is locked.
Good.
And when we transfer, we want to make sure that we're transferring to Carrie's stronger side. So if she had a weak and a strong side, this would be on her left side would be her strongest side. We're going to go towards her strongest. So we'll pretend that you've got some deficits on your right side, okay? We've got her non-skid footwear, and Lori's going to put on the gait belt, and she'll kind of go over some safety
Yes.
things with the gait belt.
When you put on the gait belt, you never want to go over the top of their head because you don't want anything to hit them, so you always go around their waist, just like that. And here's where Luann was talking about. You always go through the teeth side first, okay? And then when you pull it tight, it kind of feels kind of tight. You want to make sure you can get your 2 fingers underneath there. If women have breast tissue, you want to make sure that you're underneath the breast tissue so you're not pinching. And you can put it through there and underneath. Okay.
Lori has made sure that my feet are firmly planted on the floor, that they are secure on the floor, and that they're not dangling at this point either before the transfer.
Good. And then what I'm going to have her do is I always want to keep their weak side on the inside of my arm where I'm going to put it. I'm going to have Carrie turn her head this way and actually get her close to my shoulder right here. And then we're going to do that rhythmic initiation what Luann talked about. So I'm going to actually have Carrie come here,
And I'll just be here on the side to kind of help.
and I'm going to count. Ready? 1, 2, 3. She's going to stand up,
Beautiful.
and we're just going to
Pivot, reach
have her reach
for that.
back, and I'm going to bend my knees to push her down, or put her down.
Beautiful. That was a beautiful transfer.
The last thing I want to do is take off her gait belt. When you take off the gait belt, you want to make sure that you have the client or patient sit forward and take it out, not to pull it all the way around them, because they could get burns from the belt on their back or on their side.
All right.
Okay.
Thank you for
Thank you.
watching Jumpstart to Clinical Part 1.